I had a patient walk into my office last month. His name was James, 65 years old, retired high school teacher. He was doing everything right, or so he thought. Taking his multivitamin every morning, extra vitamin E for his heart, fish oil for inflammation. But when he sat down across from me, I could see something was terribly wrong. He was pale, bruising from the slightest touch. And when we ran his blood work, I discovered he was bleeding internally. His blood had become dangerously thin, and the culprit wasn't a disease. It was the vitamins he thought were protecting him. I'm Dr. Daniel Lee, and I've spent over a decade as a practicing physician helping seniors just like you navigate the complex and often confusing world of supplements and medications safely. I've seen too many patients harmed by vitamins they believed were harmless, vitamins their friends recommended, vitamins they saw advertised as essential for aging adults. Today, I'm going to reveal 5 specific vitamins that become dangerous after age 60, vitamins that can thin your blood to critical levels, damage your liver, destroy your nerves, and even increase your risk of heart attack. These aren't rare supplements. These are vitamins sitting in your medicine cabinet right now, and I'm going to show you exactly what supplementation, anything over 400 IU daily, actually increased the risk of death in older adults, increased mortality from a vitamin. Not in everyone, but in enough people that the guidelines changed. After 60, your liver simply can't process these megadoses efficiently. The vitamin E accumulates, and it keeps thinning your blood, day after day, dose after dose. So here's my recommendation. If you're over 60, stop taking vitamin E supplements completely unless your doctor has specifically prescribed them for a diagnosed deficiency, which is extremely rare. Instead, get your vitamin E from food. Almonds, sunflower seeds, spinach, avocados. These foods give you about 15 milligrams of vitamin E, which is exactly what your body needs. Compare that to a supplement that delivers 400, 600, even 1000 IU. That's 60 times more than what food provides. Your body was designed to handle the food amount, not the supplement megadose. And if you're on any blood thinner, aspirin, warfarin, Plavix, Eliquis, absolutely no vitamin E supplements. This is non-negotiable. Talk to your doctor if you're unsure, but do not take chances with this one. Now let's move to the second vitamin, and this one surprises people because we've been told our entire lives that it's essential, vitamin A. And yes, to take instead, because knowledge like this could literally save your life. If you're over 60 and taking any supplements, you need to watch every minute of this video. Let's start with why everything changes at 60. Here's what most people don't understand. Your body at 60 is not the same as your body at 40. After 60, your liver processes fat-soluble vitamins up to 75% slower, your kidneys filter less efficiently, your stomach produces less acid, which means even the vitamins you eat in food aren't absorbed the same way. And here's the critical part. Most seniors are on multiple medications, blood pressure pills, cholesterol medications, blood thinners, aspirin. Every one of these changes how your body handles vitamins. A supplement that was perfectly safe at 45 can become toxic at 65, not because the vitamin changed, but because your body did. Fat-soluble vitamins like A, E, and K don't just pass through your system. They accumulate in your liver, in your fat tissue, building up over weeks and months until they reach dangerous levels. This is why the handful of supplements you take every morning without a second thought could be putting you at serious risk. Let me show you exactly which ones. The first vitamin you need to stop taking immediately. Vitamin A is essential for vision, for immune function, for healthy skin. But here's the problem. Vitamin A is fat-soluble, which means it's stored in your liver. Too much of it becomes toxic. And after 60, your liver's ability to process and eliminate excess vitamin A slows down significantly. I had a 72-year-old patient, let's call her Margaret. She was taking a senior multivitamin every day, which contained 5,000 IU of vitamin A. But she was also taking an extra vitamin A supplement because she'd heard it was good for her eyes. She was double dosing without realizing it. 6 months later, she came in complaining of fatigue, dizziness, and nausea. We ran her liver enzymes, and they were dangerously elevated. Her liver was struggling to process all that vitamin A. We stopped both supplements immediately and monitored her for months. It took almost a year for her liver function to fully recover. Here's what you need to know. The safe upper limit for vitamin A in seniors is 3,000 IU per day, but most multivitamins contain 5,000 to 10,000 IU. And if you're taking a multivitamin plus an extra eye health supplement, you could be getting 15,000 IU or more. At those levels, vitamin A toxicity causes liver damage, bone fractures because it interferes with calcium metabolism, hair loss, dizziness, and in severe cases, even death. Now here's the key difference that most people don't know. There are 2 forms of vitamin A, There's beta-carotene, which comes from plants like carrots, sweet potatoes, and dark leafy greens. Your body converts beta-carotene into vitamin A, but only as much as it needs. Is vitamin E. For decades, we told patients that vitamin E protects your heart. And in food, in small amounts, it does. But vitamin E supplements are a completely different story, especially after 60, and especially if you're on any blood thinner. Let me tell you what happened to James, the patient I mentioned at the beginning. James was taking 400 international units of vitamin E every single day, plus a daily aspirin for heart protection. He didn't realize that both of these thin your blood. Vitamin E is a natural anticoagulant. It interferes with your blood's ability to clot. When you combine it with aspirin or warfarin or Plavix or any blood thinner, you're asking for trouble. The warning signs started small. James noticed he was bruising easily. A minor bump against the kitchen counter left a dark purple bruise on his arm. Then the nosebleeds started. Nothing seemed to stop them. When he finally came to see me, we ran a test called an INR, which measures how long it takes your blood to clot. His number was critically high. Another week, maybe 2, and he could have bled internally into his stomach, his brain, anywhere. We had to stop 3 of his supplements immediately, and vitamin E was at the top of the list. Here's what the research shows. A major study from Johns Hopkins University in 2005 analyzed data from over 135,000 patients and found that high-dose vitamin E if you eat too many carrots, the worst thing that happens is your skin might turn slightly orange. You cannot overdose on beta-carotene from food, but synthetic retinol, which is the form in most supplements, has no such safety mechanism. Your body absorbs all of it, and it accumulates in your liver with no off switch. So here's what I want you to do right now. Go to your medicine cabinet, grab your multivitamin, and look at the label. Find the line that says vitamin A. If it lists more than 3,000 IU, or if it says retinol or retinol palmitate instead of beta-carotene, you're taking too much. Switch to a multivitamin that uses only beta-carotene. Or better yet, get your vitamin A from food. One medium sweet potato gives you all the vitamin A you need for the day, in the safest possible form. Margaret recovered, but it took time and careful monitoring. Don't let this happen to you. The third vitamin on this list is one I used to recommend myself. Vitamin B6. B vitamins are water-soluble, which means they're supposed to be safe. You take what you need and you urinate out the excess. That's true for most B vitamins, but B6 is the dangerous exception. High doses of vitamin B6, anything over 100 milligrams daily taken long-term, cause permanent nerve damage. This condition is called peripheral neuropathy, and I've seen it destroy patients' quality of life. Let me tell you about Robert. He was a 70-year-old retired electrical engineer, sharp mind, active lifestyle. He started taking a B-complex supplement because he'd heard it boosts energy. The label said it contained 100 milligrams of B6. He figured more is better, so he took it every single day. After about a year, Robert started noticing tingling in his fingers, then numbness in his feet. He came to see me, and I immediately recognized the symptoms. Peripheral neuropathy from B6 toxicity. We stopped the supplement right away, but the damage was already done. The numbness in his feet improved slightly over the next 6 months, but the loss of sensation in his fingers never fully recovered. Robert used to play classical guitar. He can't anymore. The fine motor control is gone. Here's what makes this so tragic. The recommended daily amount of vitamin B6 for seniors is only 1.7 milligrams. That's it, less than 2 milligrams. But walk into any pharmacy and look at the B-complex supplements on the shelf. They contain 50, 100, even 200 milligrams of B6. That's 60 to 100 times more than what your body needs. And because it's labeled as a B vitamin, people assume it's safe. It's not. Anything over 10 milligrams taken daily for extended periods puts you at risk for nerve damage. And the worst part? The damage is often irreversible. Your body gets all the B6 it needs from food: fish, chicken, potatoes, chickpeas, bananas. These foods provide 1 to 2 milligrams per serving, which is perfect. You cannot develop B6 toxicity from food, no matter how much you eat. The problem is exclusively with supplements. So here's my advice. If you're taking a B-complex supplement, read the label right now. If it contains more than 10 milligrams of B6, throw it away. I'm serious. The risk is not worth it. And if you're experiencing any tingling, numbness, or loss of sensation in your hands or feet, stop all B vitamins immediately and see your doctor. The sooner you catch this, the better your chances of recovery. Now we come to vitamin number 4, and this is the one that shocks people the most: calcium supplements. We've been told for decades that calcium prevents osteoporosis, strengthens bones, especially important for women after menopause. And calcium does do those things, but only when it comes from food. Calcium supplements, especially in high doses, can actually increase your risk of heart attack. Here's what happens. When you take a calcium supplement, you're dumping 500, 600, sometimes 1,000 milligrams of calcium into your bloodstream all at once. Your body can't absorb more than about 500 milligrams at a time, so the excess just floats around in your blood, looking for somewhere to go. In younger people, the kidneys filter it out fairly quickly, but after 60, especially in postmenopausal women, that excess calcium starts depositing in your arteries. This is called arterial calcification, and it's a major risk factor for heart attack and stroke. A study published in 2016 in the Journal of the American Heart Association followed over 2,700 adults for 10 years. They found that people who took calcium supplements had a 22% higher risk of heart attack compared to those who got their calcium from food. 22%. That's significant. But here's what's interesting. The study also found that people who consumed high amounts of calcium from dairy, leafy greens, and sardines had no increased risk. In fact, they had better heart health. So what's the difference? The difference is how your body processes it. Calcium from food is absorbed slowly, over hours, along with other nutrients like vitamin K2, magnesium, and vitamin D. These nutrients work together to direct calcium to your bones and teeth, where it belongs, and away from your soft tissues and arteries. But calcium from supplements bypasses this natural regulation system. It floods your bloodstream, and without enough vitamin K2 to direct it properly, it ends up in your arteries. Now, I'm not saying calcium is bad. You need calcium, but you need it from the right sources and in the right form. If you absolutely must take a calcium supplement, never take more than 500 milligrams at once, and always take it with vitamin K2 and vitamin D3. K2 activates proteins that bind calcium and direct it to your bones. Without K2, calcium supplementation is actually dangerous. And here's the other thing. Before you start taking calcium supplements, get a bone density scan. You might not even need them. Many seniors have adequate calcium intake from food and are supplementing unnecessarily, putting themselves at risk for no benefit. The best sources of calcium are leafy greens like kale and collard greens, sardines with bones, and dairy products if you tolerate them. These foods give you calcium in the amounts your body can actually use, along with the cofactors that ensure it goes to the right places. If you're currently taking calcium supplements, talk to your doctor about getting your levels tested and transitioning to food sources instead. And now, the fifth and final vitamin you need to stop taking: fish oil. I know. Fish oil is supposed to be the miracle supplement for heart health, brain function, inflammation, and omega-3 fatty acids are incredibly important. But high-dose fish oil capsules are dangerous for seniors, especially those on blood thinners, and here's why. Fish oil is a natural anticoagulant. One capsule typically contains 1,000 milligrams of omega-3. The standard recommendation is 3 capsules a day. That's 3,000 milligrams. At that dose, you're significantly thinning your blood. Now, if you're also taking aspirin, or warfarin, or any prescription blood thinner, you're combining 2 anticoagulants. The result can be catastrophic. I had a 75-year-old patient, a man named Gerald, who was on warfarin for atrial fibrillation. His cardiologist had him on a carefully controlled dose to prevent stroke. But Gerald was also taking fish oil, 3 capsules a day, because he'd read online that it was good for his heart. One afternoon, Gerald tripped on his front steps, just a minor fall. He bumped his head, didn't even lose consciousness, but because his blood was so thin, he developed a subdural hematoma. That's bleeding between the brain and the skull. By the time he got to the emergency room, the pressure in his skull was building. He needed emergency surgery. He survived, but it was preventable. If Gerald hadn't been taking fish oil on top of his warfarin, that minor bump would have been nothing. Here's what people don't understand. Eating fish is completely safe, even if you're on blood thinners. A serving of salmon gives you about 500 to 1,000 milligrams of omega-3, and it's absorbed slowly over hours as part of a complete meal. But fish oil capsules deliver concentrated doses all at once. It's the difference between sipping a glass of wine and taking a shot of vodka. Same alcohol, completely different effect on your body. In Japan, one of the countries with the longest life expectancy in the world, elderly people eat fish 3 to 4 times a week. They get plenty of omega-3, but they don't take fish oil supplements, and their rates of bleeding complications are significantly lower than in Western countries where fish oil supplements are popular. The fish provides omega-3 plus protein, vitamin D, selenium, and dozens of other nutrients that work synergistically. The capsule gives you isolated omega-3 in doses your body wasn't designed to handle. So here's my recommendation. Stop the fish oil capsules. Instead, eat fatty fish like salmon, mackerel, or sardines 2 to 3 times a week. If you absolutely cannot stand fish, consider algae-based omega-3 supplements, which provide a lower, safer dose. But if you're on any blood thinner, do not take fish oil without explicit approval from your doctor. The risk of serious bleeding is simply too high. Alright, let's talk about what you need to do this week. I know this is a lot of information, and some of you might be feeling overwhelmed right now. That's okay. We're going to break this down into simple, actionable steps. First, I want you to gather every supplement you're taking, every bottle. Put them all on your kitchen table. Now, go through them one by one and check the labels. Are you taking vitamin E? Look at the dose. If it's over 400 IU and you're on any blood thinner, stop it today. Call your doctor if you're unsure. Are you taking vitamin A? Check if it's retinol or beta-carotene. If it's retinol and the dose is over 3000 IU, switch to a beta-carotene version or get it from food. Are you taking a B complex? Look at the B6 content. Over 10 milligrams? Throw it away. Not worth the risk. Are you taking calcium supplements without K2 and D3? Time to reevaluate. And are you taking fish oil while on blood thinners? Stop immediately. Next, schedule an appointment with your doctor or pharmacist. Bring all your supplement bottles with you. Have them check for interactions between your supplements and your medications. This is critical. Many doctors don't routinely ask about supplements, so you need to bring it up. Ask for blood work to check your levels of B12, vitamin D, magnesium. These are the nutrients many seniors are actually deficient in, and testing tells you exactly what you need instead of guessing. Finally, start transitioning to a food-first approach. Your body evolved over millions of years to get nutrients from food, not from concentrated pills. Almonds and spinach for vitamin E, sweet potatoes and carrots for vitamin A, fish and eggs for B vitamins, leafy greens and sardines for calcium, salmon and mackerel for omega-3. These foods provide nutrients in the forms and amounts your body recognizes and can safely process. Supplements should fill specific, tested gaps, not replace real food. Remember James from the beginning of this video, the 68-year-old retired teacher who was bleeding internally? We caught it in time. We stopped his vitamin E, adjusted his aspirin dose, and transitioned him to getting his nutrients from whole foods. 6 months later, James came back for a follow-up. His blood work was perfect, his energy was better than it had been in years, and he told me something I'll never forget. He said, "I thought I was doing everything right. I had no idea vitamins could be dangerous. That's why I make these videos, because knowledge like this saves lives." Now I want to hear from you. Are you taking any of these 5 vitamins right now? Drop a comment below and let me know. I'm Dr. Daniel Lee, and I'll see you in the next video.